My name is Tim Davis and I am a consultant hand surgeon in Nottingham. I'm going to talk to you about the treatment of ganglia. A ganglion is a cyst full of a jelly-like fluid. They arise from joints and are most commonly seen in the hand and at the wrist. They vary in size from being very small, the size of a seed, to being larger, and they can get to the size of a golf ball, but that is rare. Surgery to remove a ganglion is hardly ever necessary. Most ganglia cause no pain or loss of function, and these do not need treatment. Many of these will disappear on their own over a period of months or years. If a ganglion is causing pain or loss of function, it can be treated by aspiration of the ganglion, where the ganglion fluid is sucked out through a hypodermic needle in clinic. This usually reduces the size of a ganglion and can cause it to go away completely, but many afterwards come back, but may not be as troublesome. If after an aspiration a ganglion is not troublesome, it does not require any treatment and can be left alone and hopefully will disappear with time. If a ganglion causes persistent pain or loss of function after an aspiration, then it can be considered for surgical excision. This has to be done in the operating theatre through a surgical incision. The surgery can leave a scar which can be unsightly, but usually this is not the case. Even after very careful surgery, some ganglia recur, in which case you are left with a ganglion and a scar. The recovery from this surgery, so that you can use your hand well, usually takes 3 to 4 weeks. It is important that you and your consultant discuss how troublesome the ganglion is, whether it requires treatment, and if it requires treatment, what treatment should be considered.